A patient today asked about the treatment of their OCD. Specifically, they had said that they had been on multiple SSRIs, or selective serotonin reuptake inhibitors, and really had no significant improvement in their symptoms, and this was pretty frustrating for them. When I asked for a little bit more information about their specific trials, they told me that they had trialed Prozac and Zoloft and Lexapro and Luvox. Luvox is also called fluvoxamine, and that's one that I always want to make sure that I hear when talking about someone's trials for OCD, because it's traditionally your most effective SSRI for treating OCD. So I said, wow, it sounds like you have been on many SSRIs. How long were you on each medication? And they said, oh, for 2 or 3 months with each medication. And I said, wow, that also is pretty convincing that you had a full trial with these medications. But what doses were you on? And they told me that they were on 20 milligrams of Prozac, they were on 100 milligrams of Zoloft, they were on 10 milligrams of Lexapro, and they were on 150 milligrams of Luvox. Obviously, most individuals out there won't know exactly what the ranges of these medications are, but it should suffice to say that these are lower end doses of medications, lower to medium end doses of medications. And when treating OCD, it is not uncommon for individuals to need 40 or 50% higher than what these medications are FDA approved for depression or other anxiety disorders to get symptom resolution or significant improvement in their symptoms. So even though this person was rather frustrated that they've had 4 different medication trials in their mind and they felt that they had some severely treatment-resistant illness, I said to them that often individuals do not get improvement in symptoms or do not get significant improvement in symptoms until they get to those higher doses. So I said, which of these medications did you tolerate the best? And they said, well, actually, it was Luvox or fluvoxamine, which is traditionally the best one of these medications to treat OCD. And as mentioned, they were on up to 150 milligrams of that medication. Luvox is FDA approved to 300 milligrams. And so I recommended actually titrating to 300 milligrams. And if they still were having significant difficulty with OCD and they weren't having significant side effects with that medication, even considering going higher, going to 400 or even 450 milligrams, because this is commonly something that you'll do when treating OCD with SSRIs. I believe it's very important to explain this to patients that OCD and bulimia, actually I didn't mention that, but bulimia is very similar, where individuals tend to need much higher doses of these medications. And so without doing these full trials at the higher doses, sometimes patients can get really frustrated and feel that they have an illness that can't be treated when it's just not the case. They might just need a little bit of a higher dose than what someone would need for depression. If you believe this video pertained to you in any way, please reach out to a mental health professional, as these videos are not meant to be medical advice for anyone. They're just informative only in nature.